So what are all the different types of surgeons that exist out there, and how do you get to that pathway? Okay, well, you have to do undergrad, typically 4 years, and then medical school 4 years, and then residency. Okay, so there are general surgeons, that's like myself, that are 5-year residency programs, plus potentially research years, which could add on another 2 there, okay? So that's to become a general surgeon, all right? This is like hernias, appendixes, gallbladder, things like that, okay? But then there are fellowships from general surgery. So myself, I am a trauma surgeon. So I've done surgical critical care, which we have a fellowship here, and I'm the fellowship program director of, okay? So this is 1 year. All right, so that would be 6 total is what I did, okay? Then, though, I want to talk about other fellowships that there are. So there's cardiothoracic surgery, vascular surgery, okay? These 2 are unique in the fact that they each now have their own what we call integrated residency program, where you could do just 5 years and match directly into this from medical school. They're definitely very competitive versus doing a fellowship in these, okay? That is the more traditional route. You would do general surgery, and then you would do 2 years of vascular surgery or cardiothoracic surgery, okay? But now we have these integrated programs, okay? Another typical fellowship for general surgery is MIS, minimally invasive surgery, or maybe colorectal surgery is another option, okay? So these are all fellowships after the 5 years of general surgery, all right? Now, separate of their own pathway over here, OB/GYN, they are most certainly surgeons, would be your own pathway that you match into, along with neurosurgery, okay, which is very competitive, and it's its own pathway as well, where we're operating on the brain and the spinal cord. Orthopedic surgery, also its own pathway and also extremely competitive, also can do a fellowship in spine surgery. So if you're having spine surgery, it's done either by a neurosurgeon or an orthopedic surgeon who did an additional fellowship in spine surgery, all right? Then over here, we also have urology. Again, its own pathway, and urology also has fellowships afterwards, whether it's robotics and other types of fellowships in urological surgery. And there's also advanced fellowships in OB/GYN. Over here as well, we have other fellowships such as hepatobiliary surgery or transplant surgery or surgical oncology, okay? Those down here are all fellowships after general surgery. What am I missing here? I don't know. You guys tell me. But again, there's lots of different pathways to becoming a surgeon, and they're all very, very different, and they're all, again, continuously evolving. Oh, one of the other most competitive ones is plastic and reconstructive surgery. Typically, it was in the past a fellowship after general surgery, but now it too is its own option of the integrated 5-year pathway. So these are the 3 big ones that I can think of off the top of my head here. There's also fellowships that some of our residents have gone into, actually most recently in hand surgery. There's also fellowships in burn surgery. These 2 can tie into here. Oh, and then I forgot my friends that are oral surgeons. So that's a whole nother pathway. So, and ophthalmology too is considered, they do their own forms of surgery as well. So lots of different types of surgeons out there and lots of different ways to get to it. If you watched one of my other videos about my story, I think the general surgery pathway is a good option for somebody who knows they want to go into surgery, but is undecided on maybe their lifestyle or what they want to actually do. The reason I like being a trauma surgeon is I get to dabble in literally pretty much all of these, which is pretty cool to me. So that's why I consider trauma to be a really fun specialty and always encourage people to look into it. You do critical care, you do minimally invasive surgery, you do maximally invasive surgery. You kind of touch literally all of these touch points here as well. We operate in the chest, we operate in the abdomen, we operate on the extremities. You name it, we're kind of that utility player, which is a really unique position to be in. So I hope this video helped you guys understand what goes into being a surgeon in any of these. And if I left anybody out, I apologize. Throw it in the comments on the people I forgot out there, all my fellow surgical colleagues. Love you guys.